Hi, good afternoon, everyone. Just give us a quick moment while we go live on our social media feed. So we'll be with you in just a moment. All right, good afternoon, everyone. Derek Anderson, I'm the Executive Director of Northern Westchester Hospital here in Mount Kisco, part of Northwell Health. We're excited to be with you today. We have a lot to talk about. And really the focus for today is we want to give you an update on how we're doing as a hospital related to COVID. And then we're going to spend a majority of our time talking about the vaccine and questions you may have around that. So welcome to everybody who's joining us via Zoom, as well as those who are joining us via Facebook. Both options, please ask questions. You could post in the Q&A or the chat feature of either Facebook or Zoom. Please feel free to go ahead and start populating with questions. As soon as we cover just a little bit of material, we want to get to what's most important or what's most on your minds. So with that, I'm joined today by Dr. Marla Koroly, who is the Chief Medical Officer of Northern Westchester Hospital, and Dr. Jim Dwyer, the Chair of Emergency Medicine here at Northern Westchester Hospital. So welcome both Dr. Koroly and Dr. Dwyer. It's great to have you. And the three of us have been on these community updates a few times already. So hopefully some of the faces are looking familiar to our community. So very quickly, just to give you a status update on where we stand with COVID, as you've read or heard, our COVID numbers have continued to increase over the past couple of weeks. It started in early November, and as of this morning, we have about 37 COVID positive patients in the hospital. To put that into perspective, the peak for us in April was close to 95 at any one given time of admitted COVID positive patients. So we're at 37 right now, and that number for the last couple of weeks has been staying in the mid 30s. Right before the holiday last week, we dropped down in the 20s, and then we've been as high as the 40s. So we're kind of just hovering and oscillating in the mid 30s. We are unfortunately anticipating a little bit of a surge again after these holidays that have just passed, as well as the upcoming New Year's holiday, but we are well prepared for whatever may come. Of the 37 or so patients in the hospital as of this morning, we have 7 that are in the ICU or in the intensive care unit, which is much different than the spring. If you recall, we got as high as 30 ICU patients at one time in the ICU. With the advancement of treatment protocols and our understanding of this virus since the spring, patients are doing really, really well. And every day we have patients that are discharged and are going home. The numbers I just shared with you do not include any patients that are coming into our emergency department and then subsequently are discharged and go home. So that's another set of the population. We are actively doing a lot of testing at the Center for Healthy Living, which is an outpatient center of Northern Westchester Hospital, located next to Whole Foods in Chappaqua. Some of you may have seen or taken advantage of the testing happening there. Just so you're aware, that testing location is prescription free. It is covered by our chief physician of Northwell, Dr. Battinelli. So no prescription required. Also, there is no cost to the patient. So if you have insurance, we will work through your insurance, but there is no cost to you as a patient, including copays or any balance billing. So we may get to more of that in just a bit if there are questions on that, but just so you're aware, there's free access to testing at the Center for Healthy Living down at Chappaqua. So with that, I also just want to mention high level, despite what we've been seeing with the pandemic and even the increase in cases, the hospital still continues to function at very normal operating status. Every day we're doing between 40 and 50 surgeries. Babies are being delivered every day. Since the pandemic started, We have actively delivered over 1,300 babies, newborns welcomed into this world just since March. So there's a lot of amazing things continuing to happen within healthcare. And we so appreciate our community that has been diligent around keeping socially distant, following some of the guidelines from the CDC and the federal government and state government, as well as our experts here at the hospital, to protect yourselves and each other. And the more that we continue to do this as a community, we can continue to keep this under control. We're asked the question all the time, what do we anticipate from here, perhaps going into January? I said a few moments ago, we are expecting to continue to rise as we have seen over the past 6 weeks into our estimate is mid-January, which puts us about 2 to 3 weeks after kind of that major holiday season where we know people may have been in close contact with others. After that mid-January, our hope and our prediction is that we will start to see a decrease in COVID, admitted COVID patients. That married with the vaccine distribution that's underway, and we're going to get to that in just a moment, there is hope, and we're excited to see some of this progress on the fight against COVID. Lastly, there are a number of safety protocols if you've been in the hospital or have had a loved one here that we continue to take to protect our community as well as our staff, our team here at Northern Westchester Hospital. That includes checking symptoms at each of our entrances. All of our staff every day have to report on 10 or 12 different symptoms every day. We're very particular about keeping our COVID patients separate in separate areas of the hospital, away from our surgical areas. And one of the strong advantages of Northern Westchester Hospital is the fact that the entire hospital is private rooms. So all of our inpatients and our ER patients typically are seen in a private room. And that in and of itself lends its way to better isolation, more contained, and frankly, a better experience. So with that, I'd like to hand off to Dr. Koroly to cover just a few quick topics. For those of you who've just joined us, I'm Derek Anderson, the Executive Director of Northern Westchester Hospital here in Mount Kisco, part of Northwell Health. I'm joined by Dr. Marla Koroly, our Chief Medical Officer, and Dr. Jim Dwyer, who's the Chair of Emergency Medicine, our emergency department here at the hospital. So with that, Marla, and for those also who just joined, please feel free to post questions in the Q&A on Zoom or on Facebook. We're monitoring both feeds, and we want to, in just a few minutes, get to some of your questions. Dr. Koroly?
Okay, thank you, Derek. So thank you, everybody, for joining. So I'm mostly going to focus, of course, on COVID-19 and all the different things that we're working on really at every angle that we can to try to prevent or fight COVID-19. Big focus, a lot of different things. So Derek mentioned screening. We're continuing to do that, and we will be doing that for quite some time now. So all staff, all patients, all visitors are screened for symptoms. We take temperatures so we know what we're dealing with when people arrive into the hospital, and that's going to be ongoing. Derek also mentioned that we're doing testing. So for every single patient that's coming here for a procedure, some kind of surgery or otherwise, within 72 hours prior to that procedure, they go to the Center for Healthy Living and we test them for COVID, because if they were positive, we want to know it. Maybe we need to cancel or postpone the procedure or just do it under different conditions. Derek also mentioned that we're testing staff and family members, PCR testing also at the Center for Healthy Living anytime they want for concern of symptoms or because they're worried about travel or they just want to know, no questions asked, they can go and get tested. And that's true for our community as well. Again, by appointment, but no prescription required. We also continue to offer antibody testing for those that are interested at the Center for Healthy Living. In this case, we do require a prescription from your physician. So anybody can walk in and have that test. So that's screening and testing. As Derek mentioned, we still have patients in the hospital who have COVID-19, about 30 something of them. We're continuing to treat them. We've learned a lot over the few months that this has been going on. Certain treatments that we thought were helpful, the literature has shown us is really not helpful. So we're continuing to do supportive care. We put people in a proned position, lying down on their belly. That still helps a lot. We give them supplemental oxygen. We give them medication to prevent the formation of clots. For many of them, we use a medication, an antiviral medication that's called remdesivir. Many of our COVID-19 patients are given that. Many of them are also, if they have more severe illness, are given dexamethasone, which is a steroid that's been shown to help. So we do all of these things for the acute treatment of inpatients, and we have 1 or 2 clinical trials ongoing as well. So a new treatment that received emergency use authorization by the FDA is monoclonal antibody treatment. This is something that was approved over the last several weeks. And this is for people that have COVID-19 within 10 days of the onset of their symptoms. And they have to have, the person has to have at least one risk factor, which can be age 65 or older, or if you're younger than 65, some sort of risk factor like diabetes or an underlying immunosuppressive condition. This monoclonal antibody is given as an infusion intravenously over 1 hour. And it's been shown in randomized controlled trials to reduce a person's need to be hospitalized. So it's not meant for people that are sick enough to be in the hospital, but for people that are home, if they get the medication, they're less likely to progress and need to be hospitalized. We are providing monoclonal antibody in our field hospital. Derek is showing a photo of the field hospital, which is right on our campus. And as I said, the infusion takes about 1 hour, and then the person is observed for another hour and then can go home. So that's been very good. And since we went live on December 7th, I think as of yesterday, we treated about 160 people with this treatment and hopefully saved lives and prevented the need for hospitalization for many of them. So now I'm going to go on to talk about the vaccine. I think the moment we started, most people's questions were related to the vaccine. So we were very excited that the FDA granted what's called emergency use authorization, or EUA, to 2 vaccines in December. What's different about emergency use authorization is it's granted in a much shorter time period. So normally for a medication or for a vaccination to get approved, it requires 6 months or 1 year or 2 years of study to show that it's effective and safe. But if there's an emergency situation and there's no alternative vaccine or treatment available, the FDA is allowed to grant this emergency use authorization in a shorter time frame. So for these vaccines, instead of doing a study for 6 to 12 months, the study was 2 months. But within those 2 months, they showed very impressive data. 95% effective at preventing COVID-19 in the patients that received the vaccine compared with those that received placebo. So that was very impressive, and therefore the EUA was granted. The challenge now is that the vaccine is of limited supply, and we have to turn on distribution and administration sites very quickly. It's determined by each state how that's going to happen. So New York State has a very careful program, and they want to prioritize, which is the right thing to do, vaccinating staff that are either high risk themselves or in the highest risk type of profession. So New York State has several phases, and we still, because of this limited supply, we still have not gone past phase 1. So the general community that might be listening, unless you're one of those occupations, is not yet able to get the vaccine. It's hard to say what the time frame will be because it depends on the supply and how much we use up. So right now at Northern Westchester Hospital, we are a vaccine administration site. And so far, since the first release of the vaccine, we have vaccinated to date about 520 of our staff and physicians. Again, we're under strict guidance by the Department of Health in who we're allowed to vaccinate. So as you can see from what the slide's showing, first we have to start with healthcare workers. So And even that is within phases. We have, because you can't vaccinate everybody at once. So as the supply comes in over the first 4 weeks, we start with the highest risk healthcare workers that work in hospitals. Then we move to emergency medical personnel. Then we're able to move out to the community to physicians that are in their offices or urgent care facilities. So that's phase 1A. As we go on to phase 1B, which would be next, that's when we will start being able to vaccinate essential frontline workers. The state has yet to define exactly which frontline workers will be included, but we're thinking firefighters, police officers, and potentially other essential workers. In the past, they defined essential as grocery store and transit workers, but again, the state hasn't officially defined these essential workers. Also anticipated for phase 1B are any individual who's age 75 and older. So you don't need to have any kind of medical condition, just age alone would make one eligible. We have not heard yet when 1B will begin. We're hoping, since we're sort of at the tail end of 1A, that it'll be in the next few weeks, but until the state advises us, we're not yet allowed to go to 1B. We also don't know which hospitals or which facilities will be told and given a supply to vaccinate the 1B group. So it might be Northern Westchester Hospital or not, but once we find out, we will let our community know who can be vaccinated and where. And it would be great if we had more detail of the timing, but we just don't know that yet. After 1B, we move on to 1C, which include other essential workers, as well as people that are over age 65 or people of age 16 and above with any kind of high-risk medical condition. And then once we complete 1A, B, and C, then we would go on to other essential workers and then ultimately the general population. And again, along the way, the state is very specifically defining each phase and who's included exactly in that phase, because the term essential worker obviously is very general, and it's really up to New York State Department of Health to define who is included in that. It's probably going to take several months before we get to the general population. We're hoping that by the end of January or certainly February, we will complete everyone that is in phase 1A and 1B. But again, it depends all on the supply that we receive and that our state receives. So that is about the vaccine. There's a lot of questions that I'm just trying to see the questions that people are asking. So there's a lot of questions that people have asked about the vaccine, which we can answer, but a couple that are free, that we'll see that come later. A couple that are very common. Are you tested for antibodies or with a swab to make sure you don't have COVID before you get the vaccine? The answer is no. There's no reason that we have to test you. Anybody can get the vaccine regardless of whether or not you've had COVID in the past. If you receive certain treatment like the monoclonal antibody, you have to wait a certain number of weeks before you can receive the vaccine. So certain treatments, and we will ask people that question before we vaccinate them. Some people have asked about age. No one under 16 yet has been in the study, although now they're starting to study younger children. So right now, the 2 vaccines that we have are only for people 16 and above. There were no pregnant women in the trials. However, the American College of Obstetrics and Gynecology has made a statement that they are open to having pregnant women be vaccinated. So anyone that's pregnant should have a discussion with their obstetrician about the risks and benefits of the vaccine, and it's not a contraindication. You can have the vaccine. So there's very few actual contraindications. Let's see, other questions about the vaccine. If you have an autoimmune condition, should you get the vaccine? And the answer is yes. If there's some kind of autoimmune condition, again, you should discuss it with the physician treating you, but it's not a contraindication. You can actually have the vaccine.
So Dr. Koroly, as we know, there are a plethora of questions around the vaccine, and I think we want to try and get to as many of them, or at least group them into similar themes. Before we do that, I know, Dr. Dwyer, with your team on really the front lines of our emergency department, Can you speak for just a few quick moments before we jump back to the vaccine questions? Talk about your experience, your staff, and anything kind of additional that folks need to kind of look out for, symptoms or what you're seeing in the ER.
Yeah, sure. Thanks, Derek. So I'll pick it up with the vaccinations. So our staff really are all in the process of being vaccinated right now. The vast majority of them have already received their first shot, and they will be receiving their second shot about 3 weeks from the first. So I can tell you a little bit about my own experience. I can tell you it didn't hurt. I can tell you that I had no side effects, and the vast majority of people that we've spoken to have really had no side effects. So I'd kind of allay some of the fears, if there are any out there, the public that if they're concerned about getting the vaccine. Our early experience has been very good in terms of people tolerating the vaccine. It's just very important, I think, for to get that message out there, because we want the public to get vaccinated. That's our way out of this thing, and it's for your own health. It's for other people's health. You may be saving your own relatives or people you don't even know by getting vaccinated, and just us just crushing this thing and reducing the transmission. As far as what we're seeing in the emergency department, we are seeing a significant amount of COVID, but we're also seeing a significant amount of the more routine medical conditions. The biggest concern we had in the spring, after we hit the peak, was that people were afraid to come to the ER, and they weren't coming for things like heart attacks and strokes. We were really seeing a lot of late presentations of those things, appendicitis coming in ruptured because people were just afraid to come in. So we've seen a significant improvement in that now, but we're still seeing some late presentations of regular illness. So what I would tell you all out there in the public is that, we've really worked very, very hard to create a process in the ER to make sure that everybody is masked, everybody is distanced. We have 26 private rooms, so people are kept in private rooms. It really is a very, very safe environment to be in. And that's really evidenced by the very minimal, number of folks that work in the ER who have gotten COVID. So we're really in very good shape. We're blessed with a great facility. So if you are sick, you're having chest pain, stroke-like symptoms, you're sick with a high fever, you got to come to the emergency department. And I can just tell you that it's a safe environment to be in. Certainly with the COVID presentations. Really what we're doing is we're risk stratifying people in the emergency department. People come in critical, of course, we're immediately stabilizing those folks. But then it comes down to a lot of the things that Dr. Koroly was talking about. I mean, is someone young and healthy with COVID and they can be a treat and release? Is someone healthy enough to go home, but they have risk factors and they're a candidate for monoclonal antibody? Are they going to be coming into the hospital? They just need supplemental oxygen and steroids. So that's really a lot of what we're doing in the emergency department is really, identifying patients who have COVID and then sorting them out in terms of what they need. We know so much more now than we did in the spring. So we're really much more organized in terms of our therapeutic approach. Thanks to a lot of hard work that's been done, really, really around the country. Last thing I'll say before we kind of pick up the questions, people say, well, when should I come into the emergency department if I've been diagnosed with COVID? The biggest driver is shortness of breath. And, a lot of folks now, they actually have pulse oximeters at home. If we have a pulse ox in the low 90s, that's your oxygen saturation, that would require coming. But really, if you don't have a pulse ox, it really just comes down to how you feel. If you're short of breath, we want to see you in the emergency department. If you're not sure, you can come to the emergency department. Again, it's a safe environment to come in, get tested, and get worked up. So I'll turn it back to Derek, and we can take some questions.
Great, Dr. Dwyer, thank you. One quick question, and then we want to jump into a number of the vaccine questions. Dr. Koroly, there's a few questions that have come up around just jumping back to the antibody therapy program. What is the process for somebody to undergo this? And just to clarify, because there are a few comments about this, it is an outpatient therapy. We're offering it in our field hospital, the tent in front of the building, but it is not an inpatient therapy. It is an outpatient 1 hour infusion among the time that you arrive, the 1 hour infusion and go home. It's about a 2 to 3 hour experience in total. but it is an outpatient-based procedure. And Dr. Koroly, can you just speak briefly on what is the process for somebody to get referred to that?
So typically, if somebody makes the diagnosis of COVID-19, it would be either your primary care physician or your medical specialist, or even in the emergency department, if you were seen by one of the emergency department physicians, and they diagnosed COVID-19. There's a central clinical call center that Northwell has set up, and that call center is opened 24/7. And so the physician or nurse practitioner or physician assistant treating the patient calls that call center and makes a referral, gives the patient name and all the information, or alternatively can go online through a link on the internet and make the referral electronically. And from that point on, the call center takes over and they reach out to the patient and they make sure that they meet the criteria, and then they schedule an appointment for that day or the following day. And we're open every day to give this antibody here at Northern Westchester Hospital.
Great, thank you. Now, one of the big questions being asked is, how will I know when it's my turn to get it? So they understand the state criteria, it's being driven by the state on when we as a hospital are able to vaccinate certain populations, but how will they know? How will the general public know when they're up?
I think because the Department of Health has been very good about sending us notifications once or twice each week and letting us know who's next and who can be vaccinated. So we will make sure as Northern Westchester Hospital that we reach out to the community. We'll put it on our website, we'll make announcements, and we'll let people know who's next and where the vaccine can be given, because we're not sure whether or not it's going to be us giving it or some other community center, vaccine center that's set up. At some point in one of the phases, physician practices will also be able to set up centers to administer the vaccine. So it's very possible that if your primary care physician is in this community, a member of Northwell Health or a member of Caremount, they would be setting up vaccine administration sites as well, and then you'd be able to get it at that office. So we will do our best to keep the community informed through our social media as well as our website on what the phases are. And as I mentioned, we're still in phase 1A, vaccinating healthcare workers and first responders.
Great. Dr. Koroly, do we know how long the vaccine lasts at this point once you get that second dose?
We don't, unfortunately, because the studies are only a couple of months old. We don't know, but the best guess of scientists is that it probably would require an annual booster, but until more time goes by with that initial population, we won't be able to determine that.
Great.
And there are other vaccines also under study, just not quite close. We thought there was another one that might be close to emergency use authorization, but the data is not great yet. So we're still waiting for additional vaccines. So right now, I think a few people asked on which vaccine we've been using for our healthcare workers at Northern Westchester and at Northwell. We have received a supply of both vaccines over time. We've had some that received the Pfizer vaccine and some that have received the Moderna vaccine. So we're using both right now, and I'm sure if others are released, we'll be getting supplies of those as well.
Great. And just to clarify, for those who have just recently joined us, we're administering the vaccine based on the strict criteria that the state health department is providing. And we displayed each of those 1A, 1B, 1C, and then it moves on to the general populations of our community. Please know that we're following that. There is no real opportunity for us to deviate from that. So there are a lot of questions. Why can't we just vaccinate our populations or comorbidity-based individuals? And the answer is we're following kind of that very strict under the legal kind of guidelines that the state has given us. And beyond that, please know that I'm going to share this screen. Please just stay very close to us as a hospital. If you have a primary care provider, if not, please contact us. We'll help you get into contact with somebody. And I'm going to leave this up for just a few minutes so people can write down each of the ways, sign up for our newsletter. It is going to be as soon as we learn of when we can get to the next wave of the patients or those to be vaccinated. We're going to make sure that it's extremely clear, and we're going to try and reach by word of mouth and through these venues as best as we can. Keep in mind that the state has estimated that just those kind of 1A populations, healthcare workers in the state, are about 2 million people. Each week, hospitals are receiving vaccine doses or vials within the hundreds. So we're still probably several weeks away from being able to then broaden to a larger population. Within the next 2 weeks, we are hopefully going to be having part of our allocation from the state, whether it's Pfizer or Moderna, to be allocated for EMS workers, local VACs, Office of Mental Health workers, and others that the state designate for us to allow us to vaccinate them. So I'm going to leave this screen up as far as communicating on when, and we'll do our best. As soon as we know, we will let you know. Dr. Koroly, once somebody receives the vaccine, we know Pfizer and Moderna are both 2 doses. Pfizer requires 3 weeks in between, and Pfizer and Moderna requires 4 weeks in between dose 1 and dose 2. But once you get the dose, and a few people have asked this question, are people safe to then travel, be with family without a mask? And what is our guidance for those who have this question?
So our guidance is that, unfortunately, we still recommend that you practice the same cautions that we've been practicing: masks and social distancing and avoiding close contact. It's going to be a while before everyone's safe. And there's always the possibility that even in the middle of getting the vaccine, that you have COVID and you don't have symptoms and you could still transmit it to other people. So we really, even though we know that once you get the vaccine, probably 1 week after the second dose, you're going to reach your high immunity level. You could be carrying it at that point. You could still transmit it. So we still are recommending the same kind of precautions until a significant percentage of the population are all vaccinated, probably not until the summer or fall.
Okay, so thank you, Marla. There are a lot of questions kind of in this category, so I'm going to read one of them, but a number of you have questions about this. How does somebody 60 years and older, high risk with several comorbidities, let's say diabetes, hypertension, get in line for the vaccine? And then secondly, will I need a prescription from my general practitioner or a specialist? And then who determines my place in line and where to get the vaccine once approved? So Marla, maybe to help you answer this, I'm going to go to our slide on each of the state phases. And maybe it would be worth talking through this particular one and just reiterating for those who've joined us each of the 4 phases that we're aware of at this point.
Okay, so just to reiterate, we are still in phase 1A, but you'll notice that phase 1C talks about the person that was described in the question. So somebody who has a high-risk comorbidity or health condition, or somebody who's 65 and older, that will be phase 1C. There will be no need for a prescription. The vaccine administration sites will assess people and will determine whether they meet the strict eligibility requirement. And if they do, you will get the vaccine. As long as you fall into the risk group, there's not going to be any kind of other getting in line or prioritization. It's really just making the appointment and getting the vaccine. And again, the state hasn't released the 1C criteria. So it's only our best guess on how that's going to be managed, but I don't anticipate that you'll need a prescription.
Great. And to reiterate a number that we shared earlier, in that phase 1A at Northern Westchester Hospital, we vaccinated so far in the last approximately 12 days, about 550 of those kind of high risk workers, mostly those who are very much on the front lines working with COVID patients every day or at high risk for exposure. So right now that's the focus. And then as supply opens up, we'll look to go into these other phases based on the state guidance. Dr. Dwyer or Marla or Dr. Koroly, a question's being asked, do we know does the United States have any tools available to test for new variants of COVID, like what we heard coming out of the UK? And have we heard anything further about that?
So there is a recommendation that all laboratories that are performing PCR testing for the COVID-19 virus start to test for the new strain. So I think all the laboratories are setting up the capability to do that. We don't know a lot more about it. The companies that make the vaccine and the different scientists that have looked at the data really have no way at this point of knowing whether the vaccines will protect against this new strain, but we're hopeful that they will. The two vaccines that we have now function by making your body make antibodies against what's called a spike protein that's on the surface of the coronavirus. And the new strain has that same spike protein. So we're hoping that the vaccines will be effective, but until they're officially tested, we can't say for sure. But hopefully we'll start testing for that new strain in laboratories in this country at some point soon.
Great, thank you. There are a couple of questions that came through, and just to confirm for those who are listening, we are offering the monoclonal antibody therapy. It is an outpatient therapy. A couple of you have asked, is it the Regeneron or the Eli Lilly? The answer is both, right? Two separate products, and we offer both of them. And also, just to clarify, that is an outpatient therapy. You cannot be admitted to the hospital. And in fact, that's one of the criteria, is you can't be ill enough to be admitted to then qualify for this. So it's outpatient-based therapy. And the goal of that therapy is to reduce admissions to the hospital. And so it's likely of the 160 or so patients that have already received the antibody therapy in the field hospital. And remember, the field hospital is in front of the hospital. It's not in the main building, outpatient. Those patients, in theory, many of them are doing very, very well, and it's preventing escalation of the disease to then require a hospital. Couple of questions on Center for Healthy Living and testing. There's a question on whether we offer, quote, rapid testing at the Center for Healthy Living. And Marla, Dr. Koroly, I know we get asked this question a lot. Could we spend just a minute on rapid testing and how maybe we define that? And then maybe what does the turnaround time look like at the Center for Healthy Living if somebody were to get a COVID test there?
Okay, that's a good question. So the answer to the rapid test question is no, we do not do rapid testing at the Center for Healthy Living. We do the usual PCR test that goes out to a laboratory. It could take anywhere from 1 to 3 days to get the result back. Occasionally it could take a little bit longer. The reason we do that test as opposed to the rapid test is that it's still a much more sensitive test. Although the rapid tests have improved in sensitivity, they're still not as high quality as the actual full PCR test. We do have some rapid tests in stock in our laboratory at the hospital, but we use those when we urgently need a result. So if somebody shows up to Dr. Dwyer's emergency department and they have an acute appendicitis and they have to go to the operating room, or some other condition where they need to get admitted right away, and we don't have time to wait a day or two for the full result, then we do a rapid test that we get back in a couple of hours, and then we know what we have to do with that patient, where we need to put them, and whether we could safely do the procedure. So we really reserve this limited supply of rapid tests for those emergent kind of situations.
Great, perfect. So let's just jump back to vaccine. Questions coming up. What is our protocol for, at the time of administration of the vaccine, to manage any anaphylactic shock or any other reaction that could occur? Can you just describe what the oversight looks like?
Yes, that's a good question as well. So, that's one of the most serious potential reactions to the vaccine. Very, very rare is a serious anaphylactic allergic reaction. So thankfully right now, our vaccine administration site is right here at the hospital. So we have physicians and nurses who are trained to respond to this very, very close by that can come if there's an allergic reaction. However, we also have the equivalent of what a person would carry as an epinephrine, right in the room, so we can administer that right away if somebody has that kind of reaction. We also, normally we keep somebody for say 15 minutes after they receive the vaccine, just to make sure they don't have a reaction. But if somebody has a history of severe anaphylaxis to anything, to peanuts, to shellfish, to other medications, then we keep them for a longer period of time and monitor them. If they were to have any kind of reaction, we would do whatever we do with any acute situation in the hospital. We call a rapid response team, and a team of physicians and nurses, pharmacists come by and treat that patient. At some point, we and other places will have vaccine administration pods that are not attached to the hospital. And in those situations, there will need to be a trained observer at that site. And that could be a medical technician, like emergency medical tech, or a pharmacist, or a physician, or a nurse practitioner, or a PA who is trained to respond to such an allergic reaction. We haven't had to set that up yet, again, because ours is on site here at the hospital.
Great, and we're going to be working very closely with our community physician partners on this distribution. So the big question is, when are we getting to 1C, which is kind of that broader population? And just to reiterate the answer, we don't know. And it's not that we're being shady about it. It's because, frankly, we don't know how much vaccine we get on a weekly basis. Every several days, we get a notification that we're going to be shipped kind of a small amount. We plan for it. And then sometimes our distribution site is closed for a couple of days until we receive more. So the question is, how quickly do we think the supply issues of the vaccine will be resolved? And we hope as Pfizer, Moderna BioNTech continue to ramp up their manufacturing, we're going to start to see more and more. Remember, because both vaccines are 2 doses each, depending on which vaccine you get, they're both first dose, second dose, right? We're needing twice the supply. So we're day 13 or 11 or 12 or 13 from our first day. We're already thinking about those who got the Pfizer first dose so they can get their second dose. So please know there's a lot of logistics involved, but really because we're only 2 weeks into official approval from the state and from the EUA, from the federal government, we're kind of working as quickly as possible. We anticipate in the next couple of weeks, supply should start to increase more and more. Dr. Dwyer, can you answer this question? Are the vaccines single dose or multi-dose vials?
They're multi-dose vials, actually. And the interesting thing is that out of the multi-dose vial, we were expecting to get about 6 doses, I believe, and there's actually a 7th dose in the Pfizer vial. So I think there is certainly a limited supply of the vaccine, and what we found, I think, in both the Moderna and the Pfizer, is that there were some extra doses in those vials, and that's actually allowing us to stretch the supply of the vaccine a bit.
Okay, great. And just to clarify, somebody who's asking the question, are we doing Pfizer or Moderna here at Northern? And to date, we've received both. So one day it's Pfizer, the next day it's Moderna, and we're kind of working off of almost a daily schedule just based on what supply we get in. And sometimes we've gone 6 or 7 days without getting a supply. So it's been a very slow trickle, not necessarily a flow of vaccine yet, but we do anticipate in the next week or two for that to open up even more. And also, a lot of questions on, will my doctor's office be able to administer the vaccine? And the answer is yes, if they've applied through the state health department and the state grants them the ability to be a vaccination location, which is to say that the state is working through the verification process so that they can put into place a distribution plan for, like they did for the hospitals a couple of weeks ago, for ambulatory or physician practices, so that they make sure that the storage requirements are met, the distribution, the oversight, the documentation, all of those things to make sure that it's a safe administration are taking place. So, we're hopeful that we're going to be working very closely with a lot of our community physicians to offer it not just at the hospital, but out among the physician practices as well. So I know we've got just a couple of minutes left, and maybe we'll get to one more question. I'm sorry we couldn't answer a lot of the questions, and these are great questions. Please stay connected with us on social media. contact us. We'll try and get an answer to you to the best of our ability. And so maybe we'll end with one last question, Marla, which is, let's just pick a good one. They're all good, just to clarify, but yeah, so I apologize. I wish we had another 45 minutes, but okay, so have we had any, you know what, let me go to this question. What is our recommendation? Because there are a lot of mothers on the chat and on Facebook asking the question around, is it safe to get the vaccine if I'm a nursing mother breastfeeding? And do we have any recommendations on that? And then we'll take one more and then we'll wrap up.
Yeah, I mentioned earlier that in the actual trial of the Moderna or the Pfizer-BioNTech vaccines, there were not pregnant women, there were not children under 16, and there were not lactating women. However, the American College of Obstetrics and Gynecology recommends and feels that it is safe to get the vaccine for women who are either pregnant or lactating. It's a scientific recommendation. It's not based on hard data, but they believe that it won't do any harm to the fetus or to the newborn baby that's nursing. So the recommendation from us is that if you are pregnant or lactating, that you have a conversation with your obstetrician or pediatrician, and you make that determination with them and think about your comfort level and the risk and the benefit. But it could be very helpful. Pregnant women are at increased risk should they get COVID-19. So it certainly could make sense to be vaccinated.
Excellent. Okay, so time has gone quickly. We appreciate everybody joining us. I'm going to leave you with two quick things. The first thing you're seeing on the screen is information on how to get tested. This is the center that we mentioned down at Chappaqua Crossing next to Whole Foods, the Center for Healthy Living, which is a Northern Westchester Hospital center. No out-of-pocket expense, no prescription needed, but you must make an appointment, and the address is there. It is on our website, NWH, Northern Westchester Hospital.northwell.edu/COVID-19, one word. So that is the first resource. And then I do want to just make sure, because there are a lot of questions on how do we know when the hospital is going to be ready to distribute and offer it more widely. Again, we're basing it off of state criteria and the limited supply that we're seeing. But remember, folks, we're only a couple of weeks in. So, and we're month 11 of this pandemic so far in the United States. So let's give it just a little bit of patience as we start to get through all of those high risk providers and healthcare workers. We're going to very quickly be ready to offer it more widely based on the state criteria. But with that, here on the slide is every way you can stay connected to us. This is how we will get the message out, help you with connecting to a location, the priority listing based on the state, and we'll do our best to communicate as we kind of normally do. So stay close to us, and we are grateful for us joining us today. Thank you for all the good questions. Stay safe. Happy New Year. Please be mindful of social distancing, even with celebrating the New Year. And with any luck, by mid-January, we'll start to see the numbers come down even further. And with the vaccine, we are well positioned for an incredible 2021. So thank you to our community for everything you've done. Stay healthy. We're here if you need us. And we appreciate your time. So have a great day, everyone. Be well.